Hi guys, welcome to my rhinoplasty YouTube video. I am covering my nose so that we get a nice big reveal at the end. So, I'm gonna go over the order of the video so that you know what to expect. We have the night before the surgery where I am just putting on the topical antibiotic, and we have the morning of the surgery, and this is where I explained why I want a nose job and what I took for prep. Basically, I go over everything that I bought. And then we have pre-op, we have immediately after pre-op, we have day 1, day 2, day 3, and then we have day 4. Now day 4 gets a little bit graphic because it is the sinus rinse. After day 4, I skip to day 7 where we have the cast and stent removal. This is also a little graphic. And then we'll finish off with the 2 weeks post-op reveal, Q&A, and general notes about the video, as well as the grand reveal. I wanted to show you guys, this is my antibiotic for my nose, and it's super cute how I put it on. I get this little thing and then I pick my nose. It gives me a really valid reason to pick my nose in front of a camera. And that's it, I think. Watch, I'd be doing it completely wrong. And then I get another drop. Here, let me set this down. Thank you, Charlie, for giving me a tripod. Okay. So I go like this, long nail club, you know, everything goes on the back of your nails. And then I low-key don't enjoy this, but how can I complain? Because I know that I'm gonna be much worse after. If I can't put a cream in my nose, God forbid, there's gonna be all this crud in my nose. I did do my skincare. I just used hydrating products. This is my nose in case I don't show it later. So this is the before. And then I'll kind of like give it a little squeeze. And like, this makes my nose run. Like it, not super runny. Some nosy stuff come out. Good morning. It is Tuesday, August 3rd, and it is the morning of my rhinoplasty. So I wanted to make this video to go over all the equipment that I got and just kind of explain the background of the rhinoplasty. So I guess let's start. Let's talk about the rhinoplasty. So I am getting a primary rhinoplasty this morning at UCLA. It's going to be at 11 o'clock. It's currently like 6:50. And I'm going to get it with Jason Rustein. And fun fact, I don't know if it's Rustein or Rustein yet. I feel like, oh, I should know that. But I used to call him Jason Rustein, so I think we've come a little bit of a ways. And I have wanted a rhinoplasty for maybe at least 5-7 plus years. Like definitely since I was in high school. And I'm very lucky and fortunate that I have had the liquid rhinoplasty or filler in the nose to help lift this bridge. I've just always wanted a rhinoplasty, and I don't really feel the need to explain myself too much, but I do get a lot of comments from friends and followers who will say, oh, there's nothing wrong with your nose. Why are you getting, what's the reason for you getting a rhinoplasty? And I've kind of just been leaving those messages on read because like, I don't really want to spend the mental power to like explain myself. It's like, and one person even said like, your nose is fine, what am I missing? In my head I'm like, my opinion, you're missing my opinion, this is my nose. But you know, it's just something that I've always wanted, and I'm really looking forward to getting it. And I've also encountered a lot of really encouraging, positive people who said that the rhinoplasty was the best thing that they've ever done for their face. And so I'm really looking forward to it. It took me a really long time to, of course, decide to get my rhinoplasty because it's super expensive, but also finding the right plastic surgeon in LA was also tricky. I think most of the plastic surgeons in LA have a signature nose or have like a very like same nose that they give everybody, and so I really wanted to look like myself. I really wanted someone who didn't make the nose too petite and tiny and Tinkerbelly, just kind of more subtle changes. And thankfully I found Dr. Jason Rustein, and I feel really confident about getting the procedure with him, obviously, if we've come this far. So this morning I'm really not too nervous yet. I know I will get nervous. I've had like little 10-15 minute like windows or episodes of feeling nervous over the past couple days, maybe since Saturday-ish, and I'm not an overly nervous or anxious person, but of course I'm getting surgery, so that's something valid to be nervous about. My goal is to bring down the dorsal hump a little bit and a little tip rotation. From the tip, overall just very subtle. That's what I want to do. That's it. I want to show you guys everything that I have prepped for the rhinoplasty. I also have 2 giant pillows. One of them is, I think it's called like a father's pillow, or a husband's pillow. And then the other one is like a triangle shaped pillow for sleeping, sleeping elevated. If you can't tell, I like just woke up and brushed my teeth, so I'm a little groggy. I also have a travel pillow, a really nice travel pillow to sleep with, and I'm likely going to be sleeping with all 3. And I have a million supplements. Now, before my surgery, I was just taking arnica. I did take spirulina, and I did look up and down for research on how that could affect surgery. And I only found that it promoted healing. I don't recommend taking any supplements without telling your physician. But I took spirulina, but let's go over everything we have. Okay, we're resetting. Oh my god, I just realized that the video camera I'm using, I can turn the screen to see myself. Hello. So I'm just pulling random things out of the bag so you guys can see. This is arnica, and I just got the one for sore muscles because I could not find the like intense recovery arnica that wasn't for pain relief, but this one says it's for pain relief, swelling, bruising, minor injury. Now, I don't think that, I did not take this before the surgery because there's a lot of other additives. I don't know if you can see. No, definitely not. Alpha lipoic acid, and I think this is just antioxidants, but it helps with, it could help with swelling, it could help with inflammation. I just got really like super into vitamins maybe a couple months ago, and I brought some of the ones that could help with inflammation. Now this is the spirulina and the elderberry and the turmeric and vitamin D3. It's just like my mess of a bag. And I'm just gonna start pulling. So this is the arnica that I was taking morning and night for maybe at least a week, in hopes that it helps. Now I also like downed maybe half a 2-liter gallon of pineapple juice. It was from concentrate, so I have some feelings about that. But I also ate about half a case of pineapple, not a case, I have to show you like the little bowl that it came in, but like at grocery stores, that like little round bowl, like that big. I had at least half. I was trying to eat it all, but this is the arnica. I think I got it from Amazon, which I get a lot of supplements from Amazon, but I know you can't trust it that much. And I'm taking this arnica specifically. I have told you I have other arnicas, because the ingredients, it lists only arnica, and then other ingredients like gelatin, flour, magnesium stearate is like just part of like creating the pill. So this is like truly only arnica, though it says 500 milligrams, and on other arnica supplements it says like arnica 30x HPUS. Like it doesn't, it's not explained in terms of milligrams, so that makes me a little nervous, but not nervous, but like a little doubtful. So I have vitamin A, possibly for healing. This is for post-op. I'm just pulling everything out now. I have a ton of dry mouth. I got this from Amazon. It came in a kit of 3 3 or 4 things, so I'll show you each of those. So that is like a rinse. I guess I'll need like a straw like through this, like lozenges for dry mouth, and mouth freshening. This is a gel, and then this is a spray, and these 4 things came in the kit. Actually, I think 3 things came in the kit, but you can check it out on Amazon. Sunblock. I don't know why I put that in there. Vitamin K to help get rid of bruising after. I really just wanted everything. Like, I really wanted to cover my boundaries. Now, this is another arnica that I got, and this one was pretty expensive. Come on. Yeah. This one was pretty expensive, like in the 30s, I want to say. But this has a lot of different supplements in the pill itself, which is why I didn't take it before. It has vitamin C, it has zinc, it has arnica. Actually has 1,000 milligrams of arnica. Bromelain, which we love. Bromelain is the enzyme that is found in pineapples that can help with recovery, bruising, and swelling. Diosmin, which I've never heard of, grapeseed powder, and that is something that I should not take before surgery. I know that for sure. So that's why I didn't take this one. Yes, this is like the fancy expensive one that I got for after. Arnica bruise lotion. Zinc, just in case, and I do believe zinc helps with skin healing. So this is a nose cleanser. I just got it because it was recommended on like TikTok or something. Not this one specifically, but a nose rinse, like a sterile nose rinse. And so I got this. I think there is one that my surgeon recommended specifically. So I don't know if he's giving it to me or if I'm supposed to buy that, but thank you, Amazon Prime. Jeff Bezos. Nose tape, micropore tape. This was also recommended on TikTok. I don't know how much I'm gonna be putting this on, so we'll see. And then Nutrafol, because I cut my hair and I was looking at the saved pictures on this SD card, and I had pictures of my long, beautiful blonde hair, and that was the first time since I chopped and dyed my hair that I missed having long hair. So Nutrafol, and I got these. This is not sponsored. I wish it was sponsored because this is expensive. I got this. I just feel like my hair is falling out, and not enough to be concerned. Like, I don't have patches or anything. Like, you can't see like a hairline or anything, but just to help me grow it out. And that's what I have. Ooh, so this was also recommended to me by I asked Instagram. So if you answered your recommendations on Instagram, I read all of them. I really appreciate them. And one of them was melatonin, which I know my mom has at home. I also got Benadryl, and this Benadryl is actually, so diphenhydramine, this is a nighttime sleep aid, which is super interesting because Benadryl, like, I don't know, I've never seen it advertised for sleep. I guess it could be. I guess I'm just not in the know, but I got Benadryl to help sleep, if anything. And I think that's it. So I'm just gonna get ready and I'll take you guys along the day with me. I'm like a little scared to talk too loud, but I am past reception. I am in pre-op area. No hand IVs yet, which I'm honestly most nervous about out of everything is the hand IV. Terrified. Yeah, I'm just kind of waiting here until further notice and just hanging out. Another one of these in here in case you need it. Okay? Thank you. Put it all with your stuff. Thank you. We did it. I'm in post-op.
just got dressed and waiting for anesthesia to clear, and then we can go home. I feel really good. I don't feel like I'm in pain. I don't feel too crazy at all. Thank you. Hello.
Okay, now do you need to take something before we go?
No. Did they give me pain meds?
Well, they gave me these for you.
Oh, good. Okay.
Yeah. How you doing?
Okay, I'm good. I just want to sleep.
Yeah. Go for it.
Thanks.
Yeah.
Hi guys, it's the morning after the surgery, and you can see I don't really have bruising. I don't have like extreme swelling, and I just changed my gauze. I've been washing it. There's nothing too graphic. You may see a little stitch, a little bit of blood, but overall everything's looking good. Everything's feeling really good. I'm not in pain like at all. I have some throat sensitivity, so you can hear my throat is a little what's the word? A little hoarse. I don't feel too much pressure. I can breathe out of both of my nostrils, which is really, really impressive. So I'm really, really impressed with my recovery so far, and this is the morning after. So we'll see how we're doing. I'm still going to be taking my arnica and all my other supplements, and yeah, I'm just really impressed so far. One thing that I wanted to add, last night, sleeping was pretty difficult. And I'm a really deep sleeper. Like, I never have trouble sleeping, but I took a Benadryl. I also took a 10 milligrams melatonin, which should have hit me like pretty hard, but I woke up a couple times last night and I went to the bathroom. I got a lot of fluids yesterday, so that's likely why I had to use a bathroom. But yeah, it was pretty tough to sleep. I think sleeping upright. The two pillows that I got were pretty like hard. They were firm, and so it was kind of difficult to sleep on them. I just slept on the normal pillows, but pretty much fully upright. I'd say the worst part of recovery is the little bit of soreness in my throat, which is actually not too bad at all, especially with the throat lozenge. I read that keeping fluids and throat lozenges and sometimes cool fluids like ice water can be helpful. It's really not too bad, but that's kind of the worst. And just to go over when I woke up yesterday. So when I woke up, I was in like a post-op recovery area. It looks similar to the pre-op area. And the nurse woke me up. She was super sweet. She asked me how I was doing, how I was feeling. I felt completely fine. I just felt super tired. And she asked me if I felt ready to get dressed, and I did. And so I started getting dressed, and then as soon as I like moved, I like felt like I was gonna throw up. And I have like never really done this before, but my voice was super hoarse and I had to like whisper like, nurse, nurse, nurse. And she came in and I was like, I think I'm gonna throw up. And she gave me a in my IV, she gave me a anti-nausea medication. And after that, I was completely fine. She gave me a couple more minutes to rest and let that kick in. And then I got dressed. I was completely fine. And I got wheeled through the front of the hospital. I thought I was gonna like get booted out of the back of the hospital out of a wheelchair, like Dr. Miami style, and I wasn't. My sister was there waiting for me in the front. And my poor sister had to drive a really long time. It was like over 2 hours, right? Yeah, there was like a lot of traffic on the way to OC from LA, especially UCLA, like West LA. It felt like it took like 3 hours.
Probably a little over too.
Oh my god, yeah, it was crazy. During the ride, I did get, like, I felt a little nauseous at some points, which I was kind of worried about, but I just kind of like forced myself back to sleep, and I was like very sleepy. Like, I slept through the whole ride. That's about it. Anything else?
3 car crashes, but we made it. You woke up one time, you're like, ah!
Really?
Yeah!
Are you serious?
I swear to God.
Why did I say that?
Well, probably because there's a car crash up ahead, so I was slowing down. You're like, sorry. And then you got back out.
I think I remember that. I think I thought that you, like, we may have been getting into an accident, or like Oh, you know what? The whole ride home, it felt like we were driving really hard and fast, and I was like, but my eyes were like still closed. Oh my god, I do remember that. That's so fun. Day 2, it is a morning. I woke up with slight puffiness and a slight color you can see to this side. Still no pain, but today I feel like I have the craziest like allergies in the world. Like I feel like my sputum production like came back and it's driving me crazy that I can't like do anything about it. So there's that, but otherwise feeling good, and my throat is much better than yesterday. It feels like pretty much completely recovered and healed. Just this phlegm production is insane. This is day 3 and I pretty much feel completely healed. There's a little residual color and nose feels fine. Thankfully the allergy, congestion symptoms and phlegm went away. It was just really bad yesterday, and yeah, I'm feeling fine. I'm ready for this to come off. Hello, it's day 4. I'm feeling pretty much back to normal. I woke up and I was breathing out of my nose and not my mouth, which was a win. After about an hour or so, I started to get some congestion. I started to wonder about what else I could do to help this congestion. So I'm at CVS and we're gonna pick up some goodies that I did not have that I wish I had before, just to kind of get a little cleaner and get a little less congestion. Update, wearing a mask is horrible. All right, let's try this out. Okay, I just moved to a bathroom that doesn't have like a humming noise because I am like a little overstimulated, so we gotta like keep it down. But I just filled this up with warm water. I didn't fill it up with sterile saline, which is not smart, but I am taking oral antibiotics 4 times a day, and I also have topical antibiotics, so I'm not so worried, but I don't recommend doing this without sterile saline. I did mix the sinus rinse in this. It's gonna be very dilute, so who knows how it'll affect us, but I'm really excited to get this in my nose. I've never done this before, and I just watched the plastic surgeon Ben Talley instructional video on YouTube, and he kind of just goes for it, so that's what we're gonna do. Oh fuck. Oh fuck. It's no good. Ugh, it's just super salty and it all goes like back in my mouth. I've barely done anything and I'm like ready to call it quits. Oh, 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 oh. That doesn't look good. I think I should have been doing this. Oh, but it feels so good. I don't even care. Okay, let's try to clean this off. Oh my god. This is really graphic. I don't know if we're feeling better. Because I don't really want to like blow my nose. Let's try the other side. Oh. Rated R stuff right here. So if you don't keep your throat shut, like it just goes in your mouth. So I'm like trying to like put the tongue to the roof of my mouth so it doesn't do that. I feel like I'm just getting this all wet, but it's not. It's okay. Okay, we're good. So I don't feel like this made me feel any better at all.
Really? I think I saw that. But you're like, that was yesterday, right?
Yeah.
Okay. I was about to message you and be like, it'll be okay, but.
Fine. Yeah, thank you.
Yeah.
Thank you.
All right. So okay. So usually I go into this position here.
Yeah. Dr. Sean, I saw the.
Yeah.
Here,
Yeah. We'll give you a little. So something to protect your clothes too.
Thank you.
I'm gonna have the nurse join us in a second so she can hold a flashlight for me.
Perfect.
Alright. First thing I'm doing, I'm just looking for the stitch that's holding them in place because we don't want to lose track of them.
Mm-hmm.
So that's coming. Now we just gotta snip it. Okay. This is it coming out. Bear with it, it's not small. Always some nice boogies on the other end. This is the part that people are probably like, do you really want to see this? Okay, so that's one side. Now let's get the other side now. And not small, bear with it. Doing great though. Oh, she's a tough girl.
Yay!
Okay, go ahead and blow. Okay, that's a little harder than probably should have. Let's do a little softer. Should have told you blow. Let's blow it medium now. There you go. That's more like it.
That's probably how I messed up the Stent.
I'm just trying to clean up a little bit of the extra boogies and.
Thank you. Oh, we've come a long way from being about caring about that.
What, boogies? Yeah.
Yeah.
A little bit of spotting with it, which is totally normal.
Mm-hmm.
Tiny bit. It's not stopping. Keeps coming.
Sorry.
That's okay. Alright, that's pretty good. Like trails all the way back there, and then as you pull it a little bit in the front, more from the back comes out. So I think we got it though. Okay, that's good. Yes, that's pretty good actually. About a lot. There's a couple little ones here. Cool. Should we get some sutures out?
Let's do it.
All right, chin all the way up still. Thank you. Cool. Borrow this chair here. shape out of the way. And then these sutures now. Okay.
Mm-hmm.
Spin around here. Get the cast off now.
Let's do it. Oh, what is this process like, taking it off?
What do you mean? Like, or how do we get it off?
How's like pain?
Should be minimal.
Okay, cool.
Yeah. Just getting kind of the adhesive off a little bit,
Mm-hmm.
gently.
Cool.
Obviously, there's going to be some swelling around it.
Mm-hmm.
What day of the week did we do last week?
1 week.
Exactly Tuesday, right?
Mm-hmm.
It's really nice and sticky for you.
Mm-hmm.
There you go.
Oh my goodness.
Usually we don't drop that on the floor, but that's okay. Very well stuck, but there he goes. Yeah, that looks great.
Yay!
So there's a little bit, you know, there's swelling all through here.
Mm-hmm.
You can kind of see as I run my finger how much swelling there is right through there, and then all around the tip. But yeah, looks fantastic.
Awesome.
All right.
Yay!
Let's get you up and around.
Cool.
You want to take a quick look?
Yes, yes. Oh my gosh, this is so exciting.
It's all wider than it, you know, should be, and
I see it. I see it. It looks so good.
all this kind of more swollen all through here, so that's gonna come down.
Yeah.
But yeah.
I really love what you did with the nostrils, bringing it in. And I see swelling, and I know it's gonna come down, and oh my gosh, it's perfect.
Thanks.
Thank you.
Yeah.
How'd you do that with no bruising, no swelling, no pain?
You have swelling. You definitely have swelling,
swelling,
but the bruising we did pretty good on.
Oh my gosh.
Yeah.
Amazing.
So, do you want me to show you how to tape it too?
Yes, please.
And this helps with swelling. You want to do this at night, so that way you can wake up with a little less swelling. And so we just do little strips of tape, and this way you could kind of see how much swelling is really there too. You could kind of follow along in the mirror, and you see that. Go ahead, look in the mirror right now. So you see all that's compressed. That's how much
yeah.
swelling you have in the area. So it's a good amount.
Yeah. Got it.
And this is putting a little bit of downward compression, just like we had with the cast there.
Mm-hmm.
Right, just like that. It helps kind of get the swelling down. Again, lots of swelling through here, and that's totally normal. And there. Good. And you get fancy with the tip if you want.
Mm-hmm.
It's always hard to get the swelling out of the tip, but do a little bit long on purpose. So you go kind of like a bull ring, right?
Mm-hmm.
So you have it kind of around here, a little extra long there, and then we're gonna pinch it around the tip here in a sec. Relatively even. That, and then kind of pinch it around the tip as you can.
Mm-hmm.
So you like this. Let's adjust that one really quick. You can have it a little longer and then snip off the excess too.
Mm-hmm.
And I'll do that in a sec here.
Perfect.
So you just kind of pinch it around and then you just want to that little extra.
Feels so good.
It feels good?
Mm-hmm.
Just like that, so that you don't need that big extra hanging piece of tape.
It's so
Like that.
perfect.
Cool.
Perfect.
And I sometimes make little adjustments to make it like a little bit more here and there. Like that. That's perfect.
Thank you.
Good.
So I'll do that. How long, roughly, to?
I mean, honestly, I like I recommend
some
people.
just, like, go out, you know.
Yeah, I think honestly, I don't think you need that. Honestly, and your nose doesn't look like so like right now is the worst of it, right?
Mm-hmm.
Like if we just got the cast off, you know, with each passing day, it's going to get better and better. And usually, I would say after another week to 2 max, you shouldn't. Like enough swelling should have left that this is going to be very minimal. But you know, again, you could try it with and without. Once you get to that point, like after a week, try one night with, try one night without, and see how much of a difference it's making for you, because everyone's different. But that's for you, so you can be able to do that.
Thank you.
Any other questions or anything else?
I think we could turn these off. We're good.
Yeah,
Thank you so much.
Yeah, you're welcome.
Thank you. Like how you performed the procedure, like what you did. Someone asked me if you use like some tool, like a piezo whatever.
Ultrasonic.
Yeah.
I didn't for years because so I use man, I gotta remember.
What did you do?
Yeah, I use
Roughly.
so I use power tools, but the piezo is another version of that. But basically, piezo uses ultrasonic energy. The one I use is a fast oscillating mechanical like power rasp, basically. Pretty similar in that they're both relatively atraumatic, so I think they both work really well. And then what's the next one on that? When to wear glasses?
Yeah, so glasses, I hear if you like wear reading glasses, like I like within like the year that I can like.
No.
Okay.
So you just don't. You want to minimize when you're in the early phases. You want to minimize how long they sit on there, because yes, they're putting pressure and they could put they're putting uneven pressure over one area. So you want to minimize how much you wear them, and you want to give it a little time so enough swelling and healing is gone, so they don't not having as much of an imprinting effect. So I would say try to wear lighter glasses and give yourself another couple weeks, but it shouldn't shift any bones or anything like that. It's not going to do that.
Okay.
Worst case scenario, you just don't want to wear them for long periods, because those depressions can kind of get more inset, right? And it can. When it's in a healing phase, it can kind of cause more scarring and compression of one area down onto the bone than otherwise. So that's what we're trying to avoid. So if you're wearing them for short periods, that helps avoid that, and try to hold out as long as possible before putting them on, and make them as light as possible also helps. Cool.
It didn't feel swollen like at all. And
Does
then
it
of
feel
course,
swollen now?
yeah, now I feel like the swelling.
Dude, when we took out those things, like that long, I was like, what? All right, so what are your thoughts? First impressions?
First impressions, it's perfect. Like I know it's gonna be swollen and it looks really good. It still looks like me. I'm just really happy to be able to like move my face again. See the way he jumped off.
So first I wanted to go over everything that I took before the surgery. Within the past couple months, I got really into taking a lot of different supplements, and as you may or may not know, a lot of supplements you cannot take prior to surgery. So I stopped all of my supplements, but I did keep some of them, and I did a lot of research on which ones to take before. So first, I would say for about a week, I took arnica twice a day, morning and night, and this was a pure arnica. If you go earlier, I explained there's an arnica that just has arnica and no other additives. And I took that before, morning and night. I also took spirulina, morning and night. And I think I also took the alpha lipoic acid. I definitely took D3, morning and night as well. The night before the surgery, I ate about half a case of pineapple, fresh cut pineapple. It did make my mouth kind of burn. I also drank half of a 2-liter container of pineapple juice from concentrate. Now, I don't believe in pineapple juice from concentrate. Bromelain, the enzyme that's in pineapples, it's supposed to be like a freshly cut situation. It's not supposed to be from concentrate, but I thought, what the heck, we'd give it a go, and it seemed to work very well. So the day of surgery, of course, the night before surgery, you can't eat anything. So at midnight, didn't eat anything. Basically, the rest of the day following the surgery, I really didn't consume too much of anything. Maybe I had a little bit of juice. I did get 3 days worth of pressed juicery. The whole rest of the day, I was really tired and sleepy. So I just slept the whole ride home and slept when I got home. And then I woke up a couple times throughout the night. And I believe that first day I did do a nasal rinse. And then the first 5 days I took a sleep aid, and so I took 10 milligrams melatonin and the diphenhydramine. I don't know the dose on the top of my head, but I took that every single night for about 5 days to help me sleep. The first day post-op, I had zero pain. So the first day post-op, I probably took maybe 1, maybe 2 post-op pain meds. I had my stool softeners. I think I just took 1. I had antibiotics throughout. And then post-op, religiously, for about a week, I had a very intense regimen. This included vitamin K, and then I started the expensive arnica that I mentioned. That arnica had bromelain in it. I also daily took the muscle pain arnica that I showed you guys, like the first thing. I started taking the Nutrafol, and I also took the vitamin A. And I kept taking spirulina, turmeric, and elderberry. The first 3 days I was doing the Ocean nasal spray about 3 times a day. And I didn't do the sinus rinse until day 4, and then I showed the video of the sinus rinse. That I did it about 3 times a day, but I didn't really get the hang of it until day 6. It really didn't seem to help my congestion at all. It seemed to kind of make it worse. I just felt like there was a lot of fluid in my face and in my sinuses. But once I got to about day 6, I got the hang of it, and then it felt like I was actually clearing and I could breathe much better. But the entire time throughout, unless I was congested, I was able to breathe through both of my nostrils. Somewhere around day 5 and day 6 with the sinus rinse, I was getting really big clots out. It was really nasty. And then on day 6, post sinus rinse, I blew my nose really hard and I moved the stents. Kind of moved forward and it felt really uncomfortable. I would describe it as you took your shoe off halfway. That's what the stents felt like. They're slightly gonna come out of my nose, but they were partially out of place and it was uncomfortable. And then day 7, before the cast removal, I took one of the prescribed pain medications. I actually had a couple followers who were telling me that this was an extremely painful process, and they were not lying. So that's about everything that I did throughout the first week post-surgery. Now we're moving on to some notes. I was most fearful of the hand IV because I knew it was going to be an 18 gauge just in case I happened to need blood. But the hand IV actually didn't hurt at all. She injected a little bit of lidocaine and she massaged the area. And when she placed the 18 gauge, it didn't hurt at all. I was amazed. Days 2 to day 5, I remember day 3 was a little bit better, but from days 2 to day 5, I was extremely congested and it made me very irritable. The day 4 where I did my sinus rinse, I said that I was a little overstimulated, and at that point I couldn't really tolerate noises because all of the overstimulation with sounds and congestion was just too much for me. So back to the cast and stent removal. The stent removal felt like an extreme amount of pressure. Not extreme, it wasn't horrible, but it was definitely uncomfortable. I'm really glad that I took the very low dose of prescription pain medication. Anybody who's gonna go through that process, I would highly recommend getting a prescription pain medication if you don't have one. And if someone were to tell me, oh, we don't prescribe pain, I would say I could not do it without pain medication. If I accidentally touched a stitch, I don't know, a suture, if I touched a suture, it was very painful. It was really sensitive and uncomfortable, and I did not enjoy if I accidentally touched it. So when he removed the stitches, it was uncomfortable. I was very, very uncomfortable. I'd say that was about the same amount of pain as the stent removal. And then once he took the cast off, I really didn't feel swollen before that. I felt like I had zero swelling, but when he took the cast off, all of a sudden I felt the pressure that my nose had. When I inject my patients and say they're getting lip filler or some other injectable of filler where they're going to experience some swelling, when they see themselves, I tell them they're gonna have about 30 seconds of a little bit of a shock factor because they're not used to seeing themselves with change and they're not used to seeing swelling. They feel numb, they feel funny. So it does look odd when you look into a mirror for the first time. So I knew when I looked at myself, there was swelling and I didn't have the best image of myself because of everything that I was feeling. So there was a little bit of a shock where I wasn't like immediately, oh my gosh, so in love. And I wish I was because that nose looks so good. But that love came right after when I got to see the video and see the nose from a different perspective. And then I appreciated it so much more. And then I taped my nose for about a week. The first 2 to 3 days, I was fairly religious with taping my nose. And then after that, I was a little more lenient, and after about a week, I completely stopped the tape. So throughout the entire healing process, I had zero pain. I had basically zero bruising, hardly any discomfort, just related to congestion. So I do believe that my healing process, it's rather misleading. I was fully expecting going into surgery that I would come out with 2 black eyes, I would be in a lot of pain, I'd be extremely uncomfortable, and it would be a rather unbearable process. I was wholly expecting that. And honestly, anybody else, I would probably expect that as well. But for some magical reason, maybe not so much of magic and more of my surgeon being a really awesome surgeon and also a little help with some supplements, I had a very amazing healing process. I do think everything that I am explaining and everything that you're seeing on this video is a little misleading because I don't expect surgery recovery to be this good. I think I got really lucky and also had an incredible surgeon. So now current update, I'm about 2 weeks and 2 days post-surgery. You can see my nose. There is a tiny little lift in the nose from swelling. It feels rather firm. I have full sensation everywhere. I'm not uncomfortable. I can move my face how I'd like to move my face, which is really nice. There is a tiny bit of numbness around some areas of the base of the nose, which I'm not surprised because he did move the nostrils in. So let's talk about what changes he made and what I requested. So changes he made, I basically asked for the dorsal hump to be reduced and for the tip to be lifted. Being about 2 weeks and 2 days post-op, something important to know is that about 50% of the swelling goes down in a month and the other 50% of the swelling goes down over 11 to 12 months. So we're absolutely not fully healed, and most people know that it takes about a year to know what your nose is finally gonna look like. And that's my current update. I got a couple questions that I wanted to answer in this video. One is what changes the doctor made, which we kind of went over a little bit. So basically 3 things I'd say is dorsal hump reduction. I don't know if he put anything up at the top here. I believe he did because I could feel something. So I'm sure it's cartilage. He did not get it from the rib. I asked him early on where he would get the cartilage from, and he said from other places in the nose. That was super interesting to me. Cartilage in the tip, of course. I'm sure there's cartilage in the base because I feel something slightly more firm. And then he brought in the nostrils a little bit so you could see a little bit of healing around. So what was the process of finding my doctor? I have had a non-surgical nose job for maybe 6-7 years at least, if not a little longer. So I've always known that I would want a surgical rhinoplasty. So maybe about 5 years ago, I found a plastic surgeon. After about a year of looking at his work, he was based in LA. I thought that his noses were a little too petite. And I also thought that basically most of the surgeons in LA that specialize in rhinoplasty, they all have a signature nose look. They all kind of look very similar. And I kind of wanted it just to look like my face. I just wanted it to look like myself. And I didn't want a Tinkerbell style nose. So after I decided I was not the biggest fan of that doctor, maybe 2 years later, I found a doctor based in Orange County. He's like the #1 rhinoplasty of Orange County. And I did really like his work, and I'd still probably recommend this other plastic surgeon. After finding Dr. Jason Rustine, maybe about 2 years ago, and consistently seeing his work, I liked his work the best. To me, it looked the most natural. People looked like themselves. They didn't look like a person with a nose job. On paper, he's really impressive. And then I snooped around and did my own research and found that this was the surgeon that other surgeons had their wives and family members go to. I heard from a med student that he was very meticulous and very impressive in the OR. Even the day of my surgery, one of the, I don't know if it was an intern or if it was a resident or what, but she said that when she was in med school on the other side of the country, people wanted to go to the opposite side of the country to shadow with him or to learn from him. He seemed like the best of the best. And I believe he is the best of the best, especially after this recovery and with these results. But yeah, I'm very satisfied. So what did I ask at the consultation? So once I heard that masks could be coming off, I very quickly requested a consultation about twice. And the first steps, you could either go in for a consultation or you could do a virtual consultation. So I opted for the virtual consultation. I didn't really have too much to ask him. At the consultation, I just asked for a rhinoplasty. I believe I said I didn't want for it to be too small and I just want a subtle reduction of the dorsal hump and lifting of the tip. But at this point, I hadn't dissolved my filler in my nose. And so I was not gonna go too long with my nose dissolved. I was kind of freaked out at what that would look like. So 2 weeks before the surgery, we scheduled an in-person consultation. 2 weeks prior to that, I fully dissolved my nose. And in the in-person consultation, he took a look, pictures were taken. I actually really didn't have too much to say, just because I know what it's like when I inject a patient's lips. Most patients will ask for, I want my lips nice, but I don't want them too big, but I don't want them too small where I don't notice them. And there's really no definition of that. So everyone gets one syringe. So you kind of get a feel for the person, you get a feel for what they want. But I knew I wouldn't have to say too much. As long as he got the feel for what I wanted, I really trusted his work. Any tips that I have for someone getting a rhinoplasty, I would get 1 sitting up pillow. I got 2, and I also had the pillow that you use for flying. I tried using that pillow on the first night and I hated it, so I actually didn't use it at all. So I would get 1 sitting up pillow and then I would use your other pillows around you just to be comfortable and to be able to lay on them. I would absolutely get sleeping aids. Make sure you get medication for the cast and stent removal. Take all the arnica you can, and I would still expect black eyes and a lot of pain and a lot of discomfort post-surgery because you never know what the doctor's gonna need to do. I had another question asking if my doctor spent a lot of time with me. Now, Dr. Rustine, he's super, super sweet. He answers every question that I ask. He's very patient. He never seems like he's in a rush. It's always a good experience with him. But I think as a nurse, I know that doctors are going to be extremely busy and I know what I need to get across to the doctor and what the doctor needs from me. I really didn't take up too much time. I think if you express that you're concerned with being able to communicate your desires, then your physician should be able to sit down with you and hear you out. It just wasn't a big concern for me because I trusted his work so much. I do a lot of research so that I can be this comfortable. And last question I got was the cost. I don't know if I'm allowed to share the cost or not. I don't see why I wouldn't be allowed to. So I am going to share it. I'm all about transparency. Without insurance, The total was $20K. Insurance covered $4,000 for septoplasty, so out of pocket was $16,000. I know someone who's had a rhinoplasty with partial sedation for $3,000, and she said it was a horrible experience. I'm a huge baby, and I really don't want to take the shortcuts. I really wanted this surgery to be one and done. I don't ever want another rhinoplasty again. I wanted it done the right way, so I'd rather pay more the first time than have to worry about if I'm gonna be needing another one. I think that's everything that I have to say for this video. If you've watched the entire video, I think you're a little bit crazy. Thank you. And if you're still here, please like, subscribe, and follow me and stay in touch. And if you have any other questions, feel free to comment them and I will